Namaskar all. Myself Dr. Kirti Joshi, Assistant Professor, JV University. Today we'll discuss about nutrition care process. Nutrition and healthcare. Correcting nutritional problems, it may improve outcomes of medical treatments and help to prevent complications. And along with that, poor nutritional status, it weakens immune functions and compromises a person's healing ability. How illness affects nutrition status? How does illness affects nutritional status? We discussed in further ways in which illness can affect nutritional status. It may be affects in terms of symptoms and effects of illness or in terms of treatment. Now, firstly, we'll discuss about symptoms and effect of illness like anorexia due to any kind of illness, nausea, vomiting, pain in eating, mouth ulcer, difficulty chewing, swallowing, depression, or psychological stress may lead to reduced food intake. Inflammation associated with bowel condition, insufficient secretion of digestive enzymes like bile salts, or altered structural or functional functions of intestinal mucosa. It may lead to impaired digestion and absorption, elevated metabolic rate, muscle wasting, changes in hydration, prolonged immobilization, nutrient loss due to excessive bleeding or diarrhea, or frequent urination. It may lead to altered nutrient metabolism and excretion. In terms of treatment, if there is restrictive diet, bowel rest, surgical restrictions of head, neck, mouth, or esophagus, preparation of for surgery or diagnostic tests, surgical wounds, side effects of any kind of medication, it may lead to reduced food intake, radiation therapy, gastrointestinal surgeries, side effects of medication or gastrointestinal tract structure or function. It may lead to impaired digestion and absorption. Chemotherapy used for diuretics that may lead to increase the urination and nutrient excretion. Side effect of other medication can affect nutrient functions and it may lead to altered nutrient metabolism and excretion. Illness and their treatment may reduce appetite or food intake of a person. Pressure source raise protein and energy need of any patient. Dietary changes for acute illness, it may be temporary, can be tailored to individual preference and lifestyles. Dietary changes for chronic illness, it may require long-term adjustment in the diet and lifestyle to heal the disease or to overcome from the disease. Challenges to nutritional status, lack of strength and energy, demand emotional health, health care costs that drain functional resources. The nutrition care process, it is a systematic approach to medical nutrition therapy implemented by registered dietitians. Nutrition assessment, collection of and analysis of health related data, nutrition diagnosis, which is included in a diagnosis, nutrition intervention, appropriate plan to overcome any consequences, nutrition monitoring and evaluation, it determines the effectiveness of our intervention or our plan. Nutrition care process is a cyclic process, which means first of all we do nutrition screening or referral services. It may lead to nutritional assessment and after nutritional assessments there are nutritional diagnosis. If there is any special nutrient intake is insufficient, or then we plan a nutrition intervention to overcome that disease or that malnutrition or that deficiency, and then nutrition monitoring and evaluation for find out the effectiveness of our intervention. Then again nutrition assessment. Thank you.